It's probably the case that we will have an epidemic here in the U.S., but we can dramatically affect the contours of that, how large it is, how long it lasts, based on the kinds of steps we take right now to mitigate spread.
What has to happen?
Well, they need to start implementing measures to try to engage in social distancing, things like canceling large gatherings, maybe having certain people work from home, closing schools needs to be considered. Other countries have done that.
Closing schools everywhere or just where these outbreaks
Where the outbreaks are occurring, right. You want to target the places where you have uncontrolled spread to try to mitigate it. There's epidemic curves floating around right now among officials, both inside and outside government. And if you implement those mitigation steps very early, you can dramatically alter the contours of the epidemic, how large it gets, how long it lasts. So we're losing valuable time. We need to start thinking about these measures in the regions where there is spread right now.
We know today that there are likely chains of transmission going on throughout the United States, not that dissimilar from what we see in Seattle. And as we get more testing in the community, we start realizing that there may be outbreaks in other facilities, like the long-term care facility in Washington State, and I think we're going to see a lot more in the way of cases in the next 3 to 4 weeks. Several things are very clear. One is that the early containment efforts of trying to, in a sense, close the border, shutting down air traffic to China, screening air passengers coming into the United States, was not really successful. We really believe that that wouldn't have been successful in stopping it. It may have slowed it down slightly, which in itself is a good thing, but we knew that this wouldn't stop it. And so now what we're looking at is what happened in the Seattle area is if cases have been in our communities for 4 or 5 weeks, and assuming every 4 to 5 days you have a new generation of cases, meaning someone transmits to somebody who then transmits to somebody, we may have some well-established transmission chains already going on in our communities that we'll pick up and finally determine with this additional testing.
I do think that the detected cases thus far are the tip of the iceberg. I think there is more circulation going on. We have some scientific evidence to support that in Washington State based on viral sequences. We can deal with it. We can mitigate it. We can do our very best to control it. There are very common sense public health measures that we can do. Isolation of cases, quarantine of contacts, all doing our social distancing. We will need to do phases or versions of what they did there, I think, in terms of limiting social contact during this very unique, unprecedented time that we're facing. Of course, we're not going to do the most extreme things that they did, but many of the things that they do in terms of limiting travel and contact with others are things that are effective.
First and foremost, we should treat this particular disease just like we do treat flu. So staying away from people who are coughing and sneezing, making sure that we respect cough etiquette, that we frequently wash hands is very important. Another very important measure for everyone is if they feel ill, they should stay at home so that they can prevent the spread of the disease to others. When it comes to travel, the question is fairly individual, I have to say, when it comes to private travel. I would suggest that every person should assess their reason to travel. They should ask themselves, where am I traveling to? Is that location at risk? And then who am I traveling with? So those decisions are highly individual. Most businesses are restricting business travel to what is really necessary, and I think that's a prudent measure.